I'm going ahead with it. You all can see my first slide, I understand. Okay. So now our thing is that we have to select P medicine, and I'll be talking about the P medicine concept to you. Okay. You can write to me if you have any issues, you see. So for right now, I understand that everything is okay. Okay. So, well, we'll be doing rational prescribing, concept of P medicines, enlisting your P medicines, advantages, exercises, and summary. This is what we plan for the class today. So we'll be talking about rational prescribing. So rational use of medicines requires the patient to receive medicines uh, in the appropriate dose for the appropriate clinical need. And for the individual requirements. For adequate period of time and at the right cost. Cost is very important because the patient has to afford the medicines. So rationalization of prescription practices. You have to select the best drug from the available list, prescribing adequate drug for the sufficient length of time, choosing the most suitable drug, weighing the effectiveness, safety, suitability, and availability, and the cost. So, what are the factors on which the choice of drug depends? There is a need for evidence-based rational prescription. Each GP has his or her own context with the different needs and priorities. So everywhere the needs are different, priorities are different, the diseases are different. So one has to then formulate the P medicine based on the available resources and the available disease of the area. The concept of P medicine has been propagated by WHO Action Plan on the Essential Medicines worldwide. I want to know the feedback from you that you all can hear me, you can understand me. So the P in this medicine is that P could be a personal, practical, priority, or preferred. Now selecting your own set of P medicine. On what basis would you select your preferred medicine? Can you all attempt and let me know in your answers? What are the bases on which you should think? Tell me what are the bases on which your choice will depend. I'm getting the answers, potency, no adverse effects, disease, availability, relevance to the disorder, whether the patient has, what's that? Should be easily available, financial status, age, effectiveness, high efficacy, low adverse effects, affordability, availability, dose, benefits, cost, history, wonderful. Wonderful. All have attempted it very well. Okay. Now we have to concise all your written information. I wish we were all sitting together and then discussing this aspect. It would have come out very well. Like allergies and all, tolerance. See, all these factors which you are mentioning can be clubbed into four important things. Four important things. What are those four things? Let me tell you now. Okay? Then we will fit in all your things there. I am very happy with your responses. We will talk about those factors very shortly. First of all, whenever we are doing the P medicine, what are the things we have to have in mind? Problem, diagnosis, define patient's problem. Then you have to define therapeutic objective. Like with the patient's problem, what are you wanting to achieve? Is therapeutic objective. See, if a patient is coming with a high-grade fever for 2 days, your therapeutic objective will be bring the fever down. How will you bring the fever down? Probably you will do a cold pack or you will prescribe crocin. So this is, first of all, before anything, understand the problem, define the objective, choose the treatment. Now define the first choice. Treat without drugs is the first thing. That's what I said, cold packing. Treat with the drug and then maybe think of combinations and check for the suitability for the patient. Then you have to start the treatment. Start the treatment has to be with giving the prescription, information, instructions and warning. Then you have to monitor the patient's treatment. It's not as if you give treatment once and you forget about it. You have to monitor patient's treatment and see how you have to probably maybe change it little later if it is not working well. Monitor means you could stop, you could alter, you could change, you could prolong, whatever. So let me talk about the chronology of P treatment. Define patient's problem, specify therapeutic objective, verify suitability of your P treatment, start the treatment, give information and instructions, and monitor. See, your story does not stop at prescribing. This is what most prescribers do. You have to give the right information, right instructions, and monitor, and monitor. You cannot stop doing it, You have to see how your medicine works on the patient, how your prescription works. So first of all, you have to do the diagnosis, define the objective, make the inventory of the drugs or the groups of medicines which could be effective. Then you have, first of all, you have the P group. And then from the P group, you have to have the P medicine. I hope you can understand. For any illness, there could be a group of medicines which could be effective. Now choose an effective group according to the criteria. What is the criteria that you select? So many questions that I asked you and you were answering, you were selecting criteria. And I told you there are 4 different criteria. All your 25 things can come clubbed into 4. Number 1 is efficacy. I'm sure most of you were there, somewhere here or there. Efficacy is the effect. See, potency is not what is important. Somebody wrote potency. Potency is the minimum amount of drug which is effective in the treatment. See, potency is not what is needed. Kitni bhi dawai de do yaar, 50 milligram do ya 200 do. It has to be effective. So more than potency, it is the efficacy. It has to be the effectiveness. Then it is safety. Then it is suitability. Somebody said koi comorbidity, suitability define karega. Then suitability can be defined by allergies. Somebody mentioned suitability is the patient's age. कि इस उम्र में कौन सी दवाई suitable है, कौन सी बच्चों को दे सकते हैं. So see, your 25 things come all clubbed under the point suitability. Okay? Efficacy. सबसे पहले तो आप efficacy देखोगे ना, but it has to be effective. Then you have to look at safety, then suitability, then cost. Cost is also very important. You must realize that cost factor is more important for chronic diseases, and suitability and cost more important for chronic diseases. Acute diseases, you are more reliable on efficacy and acute safety. Okay, this point is clear. I would like to have your answers. Am I clear till now? So that we can now move on to the next slide. Efficacy. Choose an appropriate class of drug. Choose the appropriate drug from the above class. Lower the, that is the efficacy. Safety, lower the adverse effects, safer is the drug. Somebody just wrote no side effects. There is nothing in this world which comes with a no side effect uh, option. So everything will have some adverse effect or the other. It could be more or less or severe. So it should be least amount of adverse effects is what we should be talking about. So lower the adverse effects, safer is the drug. And therapeutic index has to be broader. Okay, narrow therapeutic index means adverse effects are more. Suitability, big group. Varies from individual to individual, depends upon age, sex, pregnancy, comorbidities, unconsciousness, drug formulation, routes of drug administration. Then you have cost comparison. See, suitability has got so many things, whether the person is pregnant or a child or a comorbid person, all that comes under, and in emergency, unconscious, all that comes under suitability. Cost comparisons. You have to compare cost per tablet, per unit, cost per day, cost of the treatment, and cost of hospitalization. So for that, you must consult books like MIMS and SIMS. I hope you know what these books are. These books are available with any bookshop. They will give you the various trade names of the various drugs and their doses. Of course, doses should be checked from the textbooks only, and the cost. So please keep that in mind, that you have to buy such books, which will be available. And on the, I'll write the name of the book. Drug Today is good. You must possess that. It's not very expensive. Under 500, I guess. Drug Today, MIMS, SIMS. Those people who have got their parents as prescribers, they would have seen these books. These books are available in the market, and they will give you various trade names, the cost. So cost can be checked from them. Am I right? Am I clear? So shall I move on to the next slide? So what is this cartoon all about? I sold my remaining grains at home to buy this medicine suggested by the doctor, but this is just a tonic. So the thing is, you have to have the cost of the medicine definitely in mind, because a person would like to sell off everything to buy medicine, and the medicine has to be worth it. So please don't see to it that the patient don't reach that level wherein they cannot afford and they have to be really sad. Okay. So now there is this, look at this table, wonderful table. 4 things: efficacy, safety, suitability, and cost. So when you have a general disease, not very threatening, so you could easily give 25% score and get 100, here. So for the management of any disease, you have to score. How much score would you like to give to each of these factors: efficacy, safety, suitability, and cost? So for general disease, you could give 25% score to all and you reach at 100. But for a drug disease like bacterial meningitis, you would think that it is a very severe condition. So efficacy should be, given. Hello? Yeah. So I'm just telling you there was a discontinuation in between. So for a disease like bacterial meningitis, you would have to give a very high cost to the efficacy, probably 80% or maybe 70%. And here safety will be even reduced. And suitability and cost won't mind take much because it is a life-threatening disease and it has to be dealt with immediately. Similarly, for a general disease like bacterial cystitis, here again suitability will be more important and cost is more important because the disease is for a longer duration you have to take the medicine and the disease is not life threatening. So you can understand that all scoring of the various factors you have to do depending upon the type of illness. Am I clear? Here I want to have your answers. Uh, uh, yeah. So I hope I'm clear. Okay. So I was just telling you that these factor computation depend upon the type of disease. So then you have to write a prescription for the patient. It's not just finding out medicine, you have to write a prescription, name of the prescriber, qualification, registration number, address. Okay. Then you have to have a treatment advice. Treatment advice will depend upon name, dosage, form, strength, route, frequency, and duration. Direction to the pharmacist, direction to the patient, patient instructions, refill information, monitoring details, dispense in a special container, signature of the doctor, and the registration number. Okay? So you have to prescribe to the right patient for the right drug, dose, route, and frequency, which I've already mentioned to you. Now, sources of information of all this, which are the right drugs and right doses and right durations. Published articles in journals. Then there could be, first of all, most important is published articles in the journals. Then there could be secondary literature like review articles, newsletters, online services, tertiary literature, published books. So your somebody asked me the question on therapeutic efficacy or pharmacological efficacy. Shashwat. So it has to be efficacy, it has to be a therapeutic efficacy, of course. What is pharmacological efficacy and therapeutic efficacy? There is this term therapeutic efficacy only. I've not heard of the term pharmacological efficacy. It has to be efficacious in the therapy. Okay? So, but the details of what you select is not to be based on a very loose evidence. It has to be based on a very reliable evidence. And most reliable evidence are the published books. Sometimes the online articles can be very misleading. So you have to see what is the source of the online information that you are looking at. Now, let me talk about this problem right now. sorry. A 52-year-old taxi driver complains of sore throat and cough, which started 2 weeks earlier with cold. He has stopped sneezing but still has cough slightly at night. Patient is a very heavy smoker and often been advised to stop. Further history and examination reveal nothing special apart from throat inflammation. Doctor again advises patient to stop smoking but write a prescription for such a patient. What is your P treatment for such a patient? As I told you, we will be having a lot of P treatment exercises for various with bronchial asthma. So this is a small example which I want to give you right now. Even if you don't understand it today, we will have subsequent classes wherein you will have more exposure to this concept. So first of all, specify the diagnosis, the flow diagram which I told you. It is probably a bacterial infection, irritation of the mucous membrane, or a tumor of the lung. Anything could happen because of the sore throat. Then you have to specify therapeutic objective. Objective could be suppression of dry cough. Make the inventory of the possible treatments. Number 1 could be advise. Stop smoking, probably he's smoking. Non-medicine interventions. Drug could be cough suppressants. Since if it is a non-infective cough, it could be given by opioids or antihistaminics. Herein you bring in your knowledge of the respiratory system. Select various cough suppressants. Then you could think of prescribing some combinations. Or if you cannot treat the patient, you have to give a referral. So this will be the inventory of the various possible treatments that you can have for this illness. Now look at this advice. Stop smoking. It will have a high efficacy, high safety. For an unsuitable person, this advice will not work. And this is really no cost advice. Rather, patient will save money. Okay? So this is how you rate your advice. Then you have non-medicine or a treatment like meditation for cough. Meditation can be efficacious, may not be efficacious, but it is definitely safe. It is, if the person does, a suitable person, it will work. Of course, no cost. So this is how you rank this non-medicine treatment, which is meditation for cough. Then you have medicine group could be opioid or antihistamine. See, opioids will have high efficacy. Safety will be okay. Patient has to be suitable. Cost is not much. Similarly, when you have singled out P groups, which could be opioid or an antihistaminic efficacy will be little lower than that of the opioids. Safety is similar. Again, unsuitable patient, it will not work. Cost is almost similar. So you can say that in terms of safety, efficacy, suitability, and cost, you realize that opioids are higher than antihistamines in this case. Opioid cough suppressants. So what you will prescribe for the patient? Codeine or a dextromethorphan or an antihistaminic like a chlorpheniramine. Then you have to look up the cost of these treatments, A cost has been seen and written down. Most inexpensive is chlorpheniramine. But you have to weigh other things also. So you have to, give scoring. First of all, you have to score these efficacy, safety, suitability, and cost for each illness. And among the efficacy, you have to score what are these individual drugs going to have as a score for efficacy. Then from all the results that you have to select your P medicine, which here in this case, actually, you have to do a calculation because cost is more of codeine, but efficacy is also more. So probably cost is not that much, One can go ahead with codeine or a dextromethorphan as a present in this case. So for whatever medicine that you are choosing, medicine 1, 2, 3, you have to score them in the order of efficacy, safety, suitability, and cost. Giving you an example, for the cough treatment, first of all, you have to allocate scoring to the individual 4 factors. Here in this case, okay, you give efficacy 60 marks, safety 20, suitability 10, and cost 10. You realize that in terms of, In terms of efficacy, codeine gets 55, dextromethorphan also 55, chlorpheniramine is little less, out of 60. Then out of 20, safety, chlorpheniramine and dextromethorphan are fairly safe. In terms of cost, dextromethorphan is the cheapest. Cost is actually cheapest is chlorpheniramine, then dextromethorphan, and then codeine. When you do a full scoring of codeine, it is 77, dextromethorphan is 81, and chlorpheniramine is coming out to be 75. So these are individual methods of scoring. Somebody might give chlorpheniramine a 51 point or a 52 point. So that won't really make much of a difference. So some points here and there. So actually you have to choose amongst these three drugs only in this case, depending upon the comfort and availability and suitability. So what we understand is from this table we have chosen dextromethorphan. So my first choice, efficacy, safety, cost, suitability. For dry and tickling cough, avoid smoking. Prescribe, of course, dextromethorphan syrup 5 ml 4 times a day for 1 week. So this is the prescription that you are writing for cough, which I told you, prescribing in the proper format. I think you've already had a class on prescription writing. We will keep repeating so that you write a good prescription after you pass out from here. Everything there, doctor's sign and signature. Now, advantages of pea medicine. I hope before I move on to advantages, everything is okay with you. There is a question by Prasanna as to why will we prescribe chlorpheniramine for cough. So for cough, generally people do prefer antihistaminics. It could be an allergic cough. So it can be prescribed. Okay. There is no expectoration, so expectorant need not be prescribed. So whatever is the illness and the therapeutic objective, you can first of all define the objective and then find out the medicines. Okay. You can find out whatever medicines. There is no hard and fast. First of all, get your patient complete and then write the complaints. I hope my answer is acceptable to Prasanna and Sanjeev. So now what are the advantages of pea medicine? Pea medicine gives you more confidence, it is more convenient, less chances of unexpected side effects, less complications, increased proportion of rational use of medicine, healthcare delivery is easy and healthcare management is simple and cheaper. So all these are the advantages of pea medicine you must write down in. Now, somebody has written dextromethorphan recently found to have an acute opioid poisoning in children. So we are not giving to children. Here it is an adult, first of all. So in children, do not give dextromethorphan. And if you give everything in the right dose, right duration, it will not cause poisoning. So please do not mix up things. Look at the patient and then you think what medicine has to be prescribed. This is just an example. You can individually find your own list of pea medicines. If you are not comfortable with this prescription, you look up your textbook, find out the drugs which are helpful in the management of dry cough, and then you have to evaluate them for all these 4 parameters. I hope, Vivek, my point is clear. Pea medicine concept also helps to learn about how to handle data and concepts, new drugs, new diseases, new information, prescribing medicines dictated to you by others, no alternatives when your pea medicine can't be used. So pea medicine is very, very reliable because you know enough data about these medicines and you know how to handle them. It is not always good to prescribe absolutely new medicines for the treatment of various illnesses. And if you think one medicine does not help, you can go on to the second one. So now summarizing the whole thing. First of all,
there has to be concept of rational therapeutic, selecting your own key medicine and treating your patient. Rational therapeutic, selecting your key medicine and treating the patient. How to select key medicine?
I'm devising